Welcome to this very important event in the Monash Health calendar. I am Deepak Sangvi, Chair of the Monash Health Board of Directors. I did like to begin by acknowledging the traditional custodians of the land on which we are meeting, the Wurundjeri and Bunurong people, and pay my respects to them, their cultures and their elders past and present. I'm so pleased to be with you today to celebrate and acknowledge your decades of service to Monash Health. It has been an extraordinary year, perhaps the most extraordinary in your long time with Monash Health. I'm so proud of every member of our Monash Health team that responded to the COVID pandemic to continue to deliver the very best of care under the most challenging of circumstances. You have shown outstanding and long-term commitment and dedication. Today's event will celebrate your incredible contribution. Each of you has a different role, and whether it is keeping our health service clean, or making meals, or delivering the best face-to-face health care, your contributions make a real difference in the lives of real people. Working in health is not like any other job, and by your long service, you have shown you are special people. As you continue in your life journey, I hope you'll reflect with pride on the difference you have made to the people's lives at their time of need. I hope you will also be excited by the future as I am ahead of us. We will have the opportunity to grow and improve our care to the community. We have the vision to be a leading teaching and research health service of the international standing. I'm confident we will achieve that vision because of you. I'll finish by thanking you again for your service each and every day. You inspire me and my board members to work together in the service of a great health service. I'll now ask our Chief Executive, Andrew Strick, to reflect on the past year. Enjoy your day. You have earned it. Back to you, Andrew.
Thank you, Deepak, and welcome everybody. And a very different night, or should I say early evening that we have in store. It's been one of the highlights for our executive leadership team and many of us to celebrate the long length of service that we are tonight by meeting you, hearing stories, shaking hands and saying thank you. Tonight we're going to do it a bit different. We're doing it via this new platform that we've all had to get very quickly used to, this WebEx platform, but we hope to instill some of the sort of fun and enjoyment of previous year's events. So what does that mean? We'll hear about all of the people that are celebrating a long length of service tonight. It's our volunteers, 20 years of service, our employees with 20 years and 25 years of service. So we'll hear their names, we'll have a chat to some of them, and hopefully make it a bit interesting, ask you a few questions more broadly about your reflections of your time at Monash Health, and just see how we go. So, as you all know, to deliver an excellence in healthcare and a core principle, our mission at Monash Health, we can only do it through people such as yourselves, working as a team, coming together to deliver healthcare together, and it's through your efforts that makes us a great health service. And boy, haven't we needed it this year. It's been an extraordinary year for all of us with COVID-19, something that none of us would have ever hoped for, something that none of us would have ever wished for, and frankly could have imagined. Who would have thought that 2020 would have been the year that we've had in terms of needing to learn new things, needing to manage ourselves in a different way, relying on the kindness of others, both in our work and our home lives. It's been an extraordinary time, and it feels probably not like yesterday, but only a couple of weeks ago, it was the beginning of January, sort of just before Australia Day, when we had our very first patient our very first COVID-19 patient. Somebody had travelled recently from China, from Wuhan province. We've been reading about this infection and disease, but of course it was quite remote, and all of a sudden it was on our doorstep. And on that Friday and Saturday, I remember being very much involved with our infection prevention team, with our operational leadership team, about how we received this gentleman and also how we did what we're very good at, which is to provide high quality and timely care. He had an infection, like we deal with infections all the time, so he was managed well in droplet precautions, managed in isolation. He left us after a few weeks. There's no healthcare worker infection. He did well, received the care he needed to receive, and went home to recover. But then, as we know, over the next few weeks, it started to emerge again. We had a few more patients, and then we went through what we refer to as that first wave of infections. Again, seems like a long time ago, back in March, and we were, again, standing up our response, responding as we need to, providing that appropriate care. We started to set up testing stations, again, in rapid time, not just testing stations like the ones we have out at in the front of Clayton Road or at Casey, but also we started to set up drive-through centres so people could actually drive through and get rapid testing. And at our peak, we were doing 3,000 plus tests per day, responding to the great efforts of the community in terms of their interest in terms of getting tested, their interest in making sure that we contained this virus. By May, we'd pretty much achieved a situation where all of our team that work with our patients had been fully trained in PPE. There's over 7,000 people that had been trained in the correct use of PPE. Fantastic effort by the training team, by Katrina, the infection prevention team, in terms of pulling that program together. Great that people were so interested and responsive, and when we often think about training and our sort of goals, getting to 95% so quickly was a great achievement. Then things sort of went quiet and we thought, okay, so let's not celebrate too quickly, but things went a bit quiet, and then not too long after that we started to get a few more patients, and I think we're up to about June or July by then. We're seeing that over in the west of the state where there was a bit more going on, but our numbers started to increase and we needed to start to respond. We started to respond by reinvigorating our COVID wards, our different model of care, so that we could provide the necessary care, keep our employees safe. And I think it was around August that we got overall to our peak in Victoria of about 700 people. Around that time, we went out and did some fundraising, and with our Monash Health Foundation broke all records for a community fundraise through a mail out, and raised over $500,000 for to support research into COVID-19, both in terms of the biological nature of it, so the sort of the clinical biological laboratory side of it, but also the practical translation side of it in terms of delivery of care. Again, a great effort. And then we started to see things started to decrease through efforts such as all of ours, where we needed to sort of only leave our homes in certain circumstances, feeling uncomfortable, wondering, when was this going to end? Were we ever going to achieve it? I think, a fair number of people having some level of disbelief that this would actually ever translate to a situation where normal would ever occur. Would we ever get out to our favourite restaurants, be able to visit our family and friends that lived beyond 5 kilometres from our home? Would there some sort of normality be achieved? But we continued, and the numbers continued to drop. We had an increasing number of admissions to our health service, our contact tracers, our teams were doing a fabulous job. And here we are today. Just recently, I think it was last Tuesday, that we discharged our very last patient in Victoria, which was a sort of a nice bookend to this phase. The very first patient in Australia in Victoria, the very last patient of this phase, discharged from Monash Health, and some great celebration, I think, for all of us in marking that achievement. We heard from Professor Brett Sutton today in our employee forum, who came out to personally thank us, the work that Monash Health had done to meet a number of our clinicians, our team, our nurses, our support staff, and say thanks for the work that we've done in contributing to the efforts in Victoria. It's been a remarkable journey and really one that we couldn't have succeeded without your support. And I think during your time at Monash Health overall, I'm sure that you understand and recognise that Monash Health's made a real difference to the millions of lives of Victorians from those very early days, which you would have seen in that video earlier, to today. It's been an extraordinary journey, and I think a great journey in the sense of an indication of what's ahead, a bright future. Thank you for coming to work every day. Thank you for doing everything that you do, and thank you for choosing Monash Health to be your workplace. So tonight, our ceremony. I'm joined by several members of our executive team, and they're going to read the names of everyone that we're celebrating tonight from their commitment and their service to Monash Health and to our community. I'll also be joined by a few people who I'll have a chat to just get a bit of a feel for their journeys at Monash Health, and thank you to them for joining us. And also what we're going to do a little bit different in reflection of what this event is and also the digital nature of the event is we're going to ask you a few questions. So we're going to just pop up, I think, on the screen now. What we want you to do is we want you to go to slido.com. So you just have to type in Slido to your search engine and it'll pop up, and then you'll get to pop in your code. It's that MHLOS, so Monash Health Length of Service 2020, and you'll see on the screen a question. And that question, we're going to leave that for a little while, so jump on. You can jump on via an iPad, phone, and the first question of the night is: you've travelled back in time to your very first day at Monash Health. What would you tell yourself on that day? So what advice would you give your younger self for your first day at Monash Health, knowing what you know today? So please jump on. Bit of fun. Good to hear your thoughts. This is our third award event. We spoke to our 5 and 10 and 15 years length of service last week, and tonight we're doing those that have been with us a bit longer. We've got one more event tomorrow. So with that all in mind, we're going to celebrate and thank the time for our volunteers who have been with us for 20 years, which is an extraordinary effort of commitment, of giving of their time, their voluntary time, to our health service to work as part of our health service team and really make a tremendous difference. I'm going to have a chat to one of our volunteers in a minute, but before I do that, over to Anjali, who's our Chief Medical Officer and known to, I'm sure, all of you. Anjali, hello.
Hi, Andrew.
How long have you been with us, Anjali?
Well, it's almost going to be 11 years in January, but I got my 10-year badge last week, so...
Okay, so you were one of the award recipients, I think, on the first night. Who read your name out, Anjali?
Katrina did.
Very good. Our Chief Nursing Officer. It's sort of some nice symmetry there. Our Chief Nurse celebrating our Chief Doctor.
Absolutely.
Anjali, over to you.
Thank you, Andrew. And it's interesting because this is twice in one day that I am, have the privilege of making a connection with our volunteers today. So this morning I had the pleasure of opening a reorientation session for our volunteers, and I had the pleasure of speaking to you for a little while. That was indeed fantastic, and it is a great pleasure to welcome you back into the organization. And now it's my pleasure to announce the names of our volunteers who have been with us for 20 or plus years. What a fantastic milestone. And as Andrew said, your time that you volunteer for Monash Health brings so much care and joy to our patients as well as our colleagues. So your service and this long service is really, really valued. So to read out the names, we have 4 volunteers today who have, achieved this milestone. So starting with Pauline Stegelman, Mary Nagendira Raja, Linda Fisk, and Chris Phillips. Thank you so much for your dedicated service and congratulations on this milestone. Over to you, Andrew.
Thanks, Anjali, and great that you finished with Chris. And Chris is going to be someone I'm going to have a chat to. How are you, Chris? You might just need to come off mute, Chris.
Hang on.
Oh, no, I can hear you now.
You can hear me?
Yeah, I can.
Right.
How are you this evening?
Yeah, fine, thank you, after going through all the rigours of getting through into this system. I'm an old bloke.
Well, you're doing very, very well, Chris, and something that I think we've all had to adjust to, but you're doing very well. We always have a few little hiccups with these sort of things, so thanks for joining us. Could you just tell us a bit about what you do with Monash Health, Chris?
Well, I'm a volunteer at McCulloch House, which is the palliative care centre at the front of the main hospital. So I go there on Saturday afternoons and wander around the ward, spending time with patients, sometimes referred by the ANAM. And I guess it can be just saying good day, or it might be spending time with patient family members. But my sort of specialty is, I suppose, as a way of introduction, is that I do a bit of massage on the hands and feet if patients would like that. And that's generally a great way of conversing without having to say much.
How did you find your way into McCulloch House, Chris? Was that your choice, or was it just something that came up?
It came out of me taking a book off my library shelf one night so many years ago, called The Tibetan Book of Living and Dying. And at that time I was on my own, and I would read that at night. And at one point he talked about people who do volunteer work in hospices, that's a very rewarding thing to do. And I thought, I could do that, and I know where there's a hospice, because I'd had a friend who had died some time earlier at McCulloch House. So I rang up the next day and thought I might be inventing the wheel by saying, do you have any could I be a volunteer at your place? And I was told, well, I'll put you on to the volunteer coordinator. So I came down, had an interview, and the rest is history.
Such an extraordinary thing to be doing, Chris. Such a special time in people's lives and families' lives. Really something that is so precious. It's been I'm sure, an extraordinary journey for 20 years here. Do you have particular memories or a particular memory you'd like to share with people tonight?
Look, there's been numerous memories, and I'm a little bit not sure about talking about actual patients, but or time with patients. But one, I suppose I could just talk about, which is a bit of humour attached to it. I went into one of the single rooms one day and said good day to this lady, and she said, "What do you want?" And I said, "Well, I'm just a volunteer here." And yeah, well, what do you want? I said, "Well, I'm just here to have a yarn with you about your life, hear your life story." And she said, I've got nothing much to say. I haven't had much of a life. And anyway, I gleaned a story out of her, and she hadn't had the greatest life. Towards the end, after about 45 minutes, we were sort of getting right into the swing of it, but I did have other customers to go and see. So I said, look, I do a bit of massage on the hands and feet. Would you like a bit of that? Oh, yeah, she said, I'd love a bit of that. So while I was massaging her feet, her phone rang, and she said, oh, look, excuse me, I've got to take the call. And she said, it's my son. I said, go for it. I'll just continue on. So she's talking to her son, and she's going, I'm in heaven, she said to her son. And I said, no, not yet, you're not. I said, this might just be a precursor. So we all laughed. So there was a magic moment. And when I went back the following Saturday, I'm getting emotional thinking about this now. I was looking forward to seeing her again, but of course she died. And so it was interesting because I had to think about, well, I was looking forward to seeing her again, but that was, for me, not necessarily for her. So I had to pull myself up because we always have to think about why we are there. We're not there for our own self-gratification, but we're there for the customers or for the patients.
Chris, such a special story, and thank you for sharing that with us. I think you wouldn't be the only person getting slightly emotional on our meeting tonight. I just thought I'd finish by sharing the words of the volunteer coordinator, Laura, who said, Chris's compassion, empathy, kindness, commitment, reliability and sense of humour are a real gift to Mullucallach House, our patients, their families and employees. We feel privileged to have him on the team and know our place is a better place because of his contributions. Chris, thanks for coming tonight. Thanks for joining us. Thank you for working with us, working alongside us for 20 years. Thank you for everything you do. And thank you for sharing the story.
Well, thank you, Andrew. Pleasure.
Take care and all the best, and congratulations on the 20 years. Okay. I'd now like to move to Martin Keogh, our Chief Operating Officer, who's going to start off with our 20-year employees awards. Martin, are you there?
I am, Andrew. Good evening.
Good evening. Do you need a moment to that's an extraordinary story from Chris.
It is. It's amazing, isn't it? Fantastic.
Great to know that people such as Chris and others who give their time to our health service and for so long, and particularly at such a special time. But all our volunteers do a wonderful job. Over to you, Martin.
Thanks, Andrew. And it's my great pleasure to be with you tonight. And as you've heard, this is our third award night in this series for this year in a different format. Last week on Wednesday night, it was a much warmer night tonight and a lot sunnier. And we were talking about how people are, finding their way through this new technology, and it's a different experience. And one of our recipients last week was one of my close working colleagues, and he was down the beach with his young family, enjoying the evening, using the technology on the beach. So I'm not sure where you all are tonight. I'm home. I've got home tonight before tonight's ceremony, and I hope you have some loved ones around you to enjoy this evening, because as we know, 20 years working in one place is an enormous commitment, and you don't do that alone. You also have a family and friends that you support all of us in our work. So I hope you've got some people around you tonight to enjoy the celebrations. So getting into the list of names I've got for the 20-year recipients, the first person is Lee E. Abraham, Tanya Adams, Alabami Adebayo, Heather Allett, Ramanan Anadan, Amanda Anderson, Diana Arnhem, Rebecca Atkins, Noni Elvin, Elaine Axon, David Babbage, Zita Ballock, Joanna Begbie, Mario Boling, Roger Bell, Louise Boyd, Tracy Bradley, Rosani Brewster, Carolyn Britton, Adrian Brooks, Elizabeth Brown, Kathleen Buddy, Dallarine Bullner, Samantha Burt, Megan Bussard, Democrito Campang, Peter Carr, Michelle Coffey, Belgian Seaslake, Giuseppe Coco, Rashan Constantine, Kathleen Crespin, Jane Crossett, Melissa Callis, Jacqueline De Cruz, Rosemary Dallaperu, Susan Doyle, Jeannie Driscoll, Julie Dunn, Sarah Edwards, Gassan Edo, Anita Ellis, Lorraine Allingworth, Katie Evans, and Rosalind Fassi. Congratulations to you all on, fantastic 20 years service with Monash Health. Thank you, Andrew.
Thank you, Martin. Okay, so time to hear back from people. So you've travelled back in time to your first day at Monash Health. What would you tell yourself on that day? Don't accept all the cake you will be offered at the notorious Monash Health morning teas over the next 25 years. Get a good photo because you'll have your ID badge for a long time. Good, very good point. Relax, you've got this. It's a great supportive team, nothing to worry about. Hang on tight, you're in for a fantastic ride. Hang in there, all new jobs are tough, but you'll end up staying a long time and relishing it. Don't be nervous, you'll be well supported. Jump at every experience that comes your way. You will care for work with and meet so many wonderful people across your time. At Monash, you'll have the most wonderful opportunities presented to you to see staff grow and develop into wonderful midwives. It will be an absolute pleasure. Believe it or not, in 25 years, you'll still be happy about going to work every day. That's a great one. Dr. M, who is about to orientate you to the unit, is an inpatient on that unit who has gone to a great deal of effort to prank you. Enjoy it. Well, that sounds like it's got an interesting story behind it. So many good pieces of advice there, and I've said before that our team will have a look at some of these and see what we need to include in our orientation program. So lots of words of wisdom that we can pick up and include. So we're going to jump to our next question. And the next question is, what Monash Health moment lives in your memory? What Monash Health moment lives in your memory? So that'll pop up in a moment. So jump in and give us your response. So it's now my pleasure to introduce my colleague Karen Lowe, who's the Executive Director of People and Culture, to announce the next group of 20-year length of service awards for employees. Thanks, Karen.
Thanks, Andrew, and thanks to everybody here. What a fabulous achievement it is, 20 years service in one organisation. And the service and the gifts and the contribution you've made to our patients and our consumers and generally our community is truly amazing. But in particular, I actually wanted to thank you for the support you give our co-workers, our colleagues, because without all of the people at Monash Health, it's not a great place to work. And it's people like you that make it a great place to work. So thank you for that. So I'll start with my list of names. First one is Marina Fall, Nilmini Fernando, Paul Ferrier, Naomi Field, Lisa Fielding, Christina Fong, Maria Footman, Alistair Ford, Leanne Forrest, Natalie Francis, Sheila Francis, Leanne Fraser, Narelle Furniss, Elizabeth Galea, Jamuna Ganeshan, Justisha Garrett, Eunice Goff, Sue Go, Victoria Gordon, Victoria Green, Natalie Hale, Rebecca Hamilton, Kelly Hammerstein, Lorraine Hilly, Sue Ho, Erin Hobson, Kathleen Holland, Madeline Howard, Catherine Hugh, Paul Wynne, Anne James, Stephen Jaskolowski, Christina Johnson, Greg Jones, Ravi Kashyap, Catherine Keenan, Paul King, Danielle Kiriachi, Gordana Kusijan, Mark Kokur, Michael Kalarick, Gabriella Kolek-Sami, John Karambas, Sian Locke, so Chief Locke, Katerina Laudani, Baleen Layton, Christina Leonard, Dennis Levin and Sotiros Lim. Thank you for your service and thank you for everything you've contributed to Monash Health. Back to you, Andrew.
Thanks, Karen, and thanks for that piece of our celebration. So I'm going to have a chat to somebody else now who's one of our nurse managers at Dandenong, Julie Campbell. Are you there, Julie?
Yes, I am. Good afternoon.
Good afternoon, or good evening, or bonsoir, I think would be the other option, wouldn't it, Julie?
Yes, it would be.
You're very, I can see you've dressed for the night.
Oh, yes, just threw on something old.
I understand that this is not, maybe I'll put it, this has become to be expected of you, Julie. I hear that you're one of the fashion leaders of the health service.
Definitely. I will be very modest and say you're exactly right, Andrew.
Very good. Tell us about, where do you work at the moment, Julie?
At the moment, I manage and lead a 40-bed acute medical ward at Dandenong Hospital.
Okay, what sort of ward? What sort of?
It's an acute medical, but we do have 4 of our beds are dedicated to eating disorders.
Okay.
And of course, we do specialise in respiratory, so we're one of the first wards to overcome the challenges of our COVID patients coming through.
And you started, I think you started back at Queen Vic, is that right?
Yes, it's hard to believe, isn't it? But yes, I started in 1978, and Queen Vic was the hospital that actually gave me the opportunity to pursue a nursing career. I did knock on the door of the Alfred, but because I was a single mum at the time, Queen Vic is a hospital for women by women, and they gave me the chance, and I'm forever grateful. And to that end, it doesn't even feel like 42 years for me, and because in those days you didn't have maternity leave, and I did take off time to have 4 more children.
I think our Executive Director of People and Culture would be slightly horrified by what I suspect is going to be your answer to your question, but I think what you're saying is being a single mum at the time made it hard to get a job. I'd like to say Monash, Queen Vic, no, but of course, in those days, the Alfred, yes. Mm-hmm. And I did have connections there because I did do a stint in the bacteriology department, and I saw the nurses go by and thought, oh, gee, they look pretty swish. Wouldn't like like to be like to actually pursue that as a career, and bit disappointed, but as soon as Queen Vic took me on board, I just made sure that I made them proud. And do you have any particular favourite memories, Julie, that you'd like to share? I mean, I'm sure you've got many, but a couple of them come to mind. I knew this was going to be a question, and I was thinking about what you do is think about, well, what were the low points? And really, there haven't been any low points. Yeah. There have been challenges, but from those challenges, there's been really positive results. But I remember you tweaked my memory with my first day out in the wards, and we weren't in uniforms. I'm hospital trained. So I was the last person to get a gown, and those gowns have been around forever. And somebody had drawn some boobs on them. So I think that set the tone for my career, that I'm always one to take on board an adversity and make a little bit of a joke out of it, and create that challenge into something positive, but I'll never forget it. So that is sort of a highlight, but other highlights has been at CNS. I was an asthma educator, and I, at Monash, did hold some keynote lectures in the lecture theatre. Yep. And of course, my appointment at Dandenong to be able to lead and grow my own team is a big highlight for me. How long have you been in that role, Julie? 16 years. Okay. So I've grown a team we're a magnet ward, so hardly anybody leaves until Casey opens up those towers. But other than that, but we had many applicants to fill those roles, and it's about making sure the patient experience is optimum, but also the staff experience. So I'm really big on making sure they look after themselves and they escalate if they're having concerns about imparting safe and timely care. A wonderful feeling, though, Julie, to have a team that moves into other areas, and you can see that your influence as a leader has an influence much more broadly across Monash Health.
I agree with you there, having said that, I'm also a product of Trish Dito, Janelle Finn, Naomi Dubrov, so taken a lot on board of what they have done in their careers and utilised those learnings in my career. And hopefully I'm succession planning as we speak, that will be passed on as well. Always having an open door, a good listener, but also having passion and realising that it's too hard a job not to be passionate. I just feel like it's no time at all that I've been here.
Katrina was telling me that you're regularly a fan of the dress up. I'm slightly nervous asking this question, Julie, just a particular couple of favourite outfits.
Look, I had to cull a few of them, but there was one that I dressed up as a Christmas tree. Okay. And I decided that I would stand outside in the foyer at Dandenong, and I, like those still people there's statues that dressed up, and I moved, and I thought I might have got us some more cardiac patients, so I decided not to do that. Yes, but anything, and really, at the end of the day, Andrew, it's about showing what you can do and having that effective influence. Like when I first got to Dandenong, we didn't so much have the Christmas decorations, but we've got a lot of competition now, which really has the side effect where patients enjoy the efforts we all put in and a bit of, camaraderie in challenging each other to win. So
bit of healthy competition.
Healthy competition, yes, for the health system.
Very good. Thank you for joining us tonight, and thank you for sharing the story. It's great.
It's a pleasure. Thank you for having me.
Okay, so Julie Campbell, the nurse manager at West 4 at Dandenong, with a long and rich and interesting history and story, and a slightly nervous couple of questions there for the Chief Executive and our Head of People and Culture. But no, on a serious note, thank you, Julie, for everything you've done and continue to do. So I'd now like to invite Stuart Donaldson. Stuart, are you with us?
I am, Andrew. How are you?
I'm very good. You've got your notes tonight, Stuart? We've briefed you?
Yes, thank you. I'm all prepared and ready to go.
I threw to Stuart the other night, and poor Stuart wasn't expecting it, so we had a bit of fun.
Yeah.
I can see you've got your balloons out and ready to go. So
the background there, Andrew, just to celebrate the evening.
Yeah, very good. I'll hand over to you, Stuart.
Thanks, Andrew. Hey, look, congratulations, everybody, on the wonderful achievement of 20 years service to Monash Health and the wonderful things that you've done for the community. All of the executive are very proud of you, and hopefully you're taking a moment just to reflect on your own personal journey and wonderful contribution to the community that you've made. So well done, and I'm now honoured to read out the next list of 20 years service awardees. Keith Lewes, Roel Lumapaz, Elizabeth Mackenzie, Nadia McCarr, Adrian Ma, Jane McCormick, Sandy McGeary, Stephanie McGill, Jane McKeon, Sarah McLeod, David Merenstein, Bernadette Myers, Jane Merchan, Orlando Montero, Charito Morales, Debbie Morgan, Catherine Malria, Kamalrat Na, Jyotsna Namkumar, Melissa Nation, Gonasagari Noyagar, Stacey Neal, Campbell Newton, Linda Nicola, Melinda Norman, Deborah Norton, Edward Boo, Francis Ora, Kerry Parmos, Mary Papamihail, Rhonda Pauline, Lorraine Pereira, Adrian Pick, Hugh Platt, Nicole Porter, Arul Bragaka, Mark Prout, Antonella Puccino, Raul Kwan, Colleen Quilligan, Robin Rainsford, Claire Ransom, Pamela Remedios, Helen Ramios, Julie Ryan, Kathleen Ryan, Annette Saber, Susan Sadler, Kamanayam Sangvi, and Deborah Scott. Congratulations, everybody. Have a great evening and all the best. Over to you, Andrew.
Well done, Stuart, and thank you. Not bad for a Carlton supporter. So, responses from Slido question 2, which is, what Monash Health moment lives in your memory? Meeting some beautiful colleagues who have become lifelong friends. When a patient kicks open the seclusion door, tells the nurses to give him way, then turns to me and says, "You should be resting, you're pregnant," which I was only 3 months along, but my manager knew, no one else knew, but no one else knew. Scary, but also funny. One evening in the operating theatre, 4 different surgical anaesthetic teams worked simultaneously on one trauma patient. I knew then what an amazing professional and skilled team I worked with and how fortunate I am to be part of that. My best memories involve the awesome professionals I work with. The opening of Monash Children's Hospital, vision of a lady wearing a tissue box as a slipper, throwing a mortar and pestle at her nurse's head. Hopefully the nurses were okay. Riding on an exercise bike in the MMC foyer in a tutu next to Luke Darcy as part of a fundraising event. I don't think that was you, Stuart, was it? No comment. That is very good. Being there the first day IPM went live was chaotic, but we got there. The lifelong friendships I've made, every patient and relative who has said thank you. And when I was much younger doing night duty and having a ball with colleagues who are still friends today. Some fantastic memories. Thank you again for sharing those. We're going to move to our next question, our Slido question 3. What do you still want to achieve at Monash Health? What do you still want to achieve at Monash Health? And while you're thinking about that or typing away, it's my pleasure to invite my colleague Katrina Nankervis, our Chief Nursing and Midwifery Officer, to announce the last group of 20-year length of service awards for employees. Thank you, Katrina.
Thank you, Andrew. Hi, everyone, and congratulations. Just like to add my congratulations along with everyone else's. It is just such an achievement. You're very much part of the fabric of the place here after 20 and 25 years. And, really are the culture bearers of our organisation and importantly carry, such a lot of history, which is incredibly important in our organisation. But obviously not only the historical perspective, but a very important part of our future as well. So thank you, and I have some names to read out. So congratulations and thank you to Andy Perry, Melina Simona, Lisa Spalling, Sarah Speakman, Lee Stewart, Suzanne Sturm, Ian Summers, Shane Zwaya, Jake Tan, Nalayini Theoraja, Christy Thomas, Renee Trelaw, Chris C, Kim Ung, Sean Vandergert, John Volanakis, Joanna Vien, Sandra Villa, Chu Vin, Maretta Vong, Fu Vong, Susan Wall, Sky Wallace, Lynette Wallace, Jean Wellington, Katrina Wells, Nicole Wallen, Janelle Wiggum, Helen Wilkin, Jilska Williams, Anne Woods, Warwick Wright, Nicole White, Chris Zenos, Roanna Yogathan, I beg your pardon, I'll try that again, Joganathan, Jeanette Yona S. Janetti, Chin Yuan, Lily Zamani, and Shodi Yang. Congratulations, thank you, and back to you, Andrew.
As all members of the executive team have commented, one of the great things about Monash Health and one of the things that this event recognises is the extraordinary diversity of backgrounds and experiences that people have. So thank you, Katrina, for the celebration of our 20-year employees. It's my pleasure now I get to have a chat to Kathy Holland, Div 1 nurse in our emergency department. Are you there, Kathy?
I am, yes.
How are you doing tonight?
I'm really well, thanks.
So we can,
Really good to be here.
great. We can't see Kathy, but
No,
we can hear you very clearly, Kathy.
yeah, I can't get my video to work, I'm sorry. I'm not sure what's wrong.
That's okay. So tell us what you do at the moment for Monash Health.
I work in the Dandenong Emergency Department.
Been there for long?
Been there for 20 years.
Right. And my notes tell me that you were very first trained at the Alfred.
That's right, yes.
Right. And did you stay there for long?
I stayed there for just staffing year afterwards, and then moved on to another hospital. Then we moved out this way, and that's when I started at Dandenong.
You know, there's a few of us that have started at the Alfred and left and come in, Kathy.
I know, yes. A lot of Alfred people.
Following your tracks.
Yes.
So have you always worked in emergency?
When I first came to Dandenong before this 20 years, I worked in the children's ward for a few years. Then I left the hospital and did school nursing for a while. Came back and started in was in surgical unit for a little while and then went to emergency.
What's school nursing, Kathy?
Working in a school as the nurse, as a first aider.
Okay.
Yeah, it was a prep to 12 school. Really interesting.
Very interesting. Probably not the same sort of injury, or I hope not the same sort of things you deal with today.
No, not at all. A lot different.
Yes. And how's this year been for you, Kathy? It's been a pretty challenging year.
It's been a crazy year. I think in the beginning we were all ready, waiting for something to happen, and it all settled down very quickly, but we knew that there was going to be a second wave, and we were ready for it, just waiting for the doors to open, literally. The year has just flown. There's been, a lot of overtime, a lot of extra shifts, but it's been great. And I think if nothing else, our team in ED has become even closer because we've had to work so hard and so much together to look after each other.
That's great to hear, Kathy. Yes, the team certainly had a few times when we've had to get you together to talk about a potential infection in the team from someone coming in that we didn't know about, either a worker or somebody that's come in asymptomatic, or a patient that's come in that's asymptomatic, or someone that's developed symptoms that we have to go back a few days. And that's been I've always been very impressed by the Dandenong ED team's response.
Yeah, I think that because we do look after each other, watch out for each other, and there for times like that. So when staff have had to be furloughed, we're still in touch with them, still looking out for them, and they're still at home looking out for us at work as well.
Sorry, keep going.
So it's just a great team to be a part of. Feel very privileged.
And you would have been in the ED when we introduced the EMR.
Yes. The build up to that was frightening. I don't think any of us knew what to expect, and we're frightened of it happening. But now that it's here, it has made life so much easier. Much easier system to work with, and lots of writing. Now if we have downtime, now we're worried. We have to go back to paper and pen.
I think we can be confident that given your length of service that you might have been around the other EMR that we introduced first, the Symphony.
Symphony, yes. Yeah.
So you've done it a couple of times.
Yes, yeah. I don't think Symphony seemed to be that big a deal. It was moving on, but not a big thing. There was a lot of introduction to EMR, and it was a really big step. But yeah, it's worked out well. I think everyone's doing really well with that.
And any particular memory that you want to share with us tonight, Kathy?
Gosh, so much happens in the ED.
Oh yes, I bet.
I think back in the old ED, when I first started, one of the biggest things was when we had the helipad and a helicopter came in one night, and I was going out with one of the other nurses and perhaps a doctor or two, and it was like the adrenaline was like, am I really doing this? Am I really part of this team? You know, to be able to feel that you were capable, that's pretty amazing.
It is pretty amazing.
Yeah.
Thank you for sharing that, and thank you for everything you do for Monash Health, and congratulations on your Length of Service Award.
Thank you, and thank you to Monash Health for what you have given me. Thank you.
Thank you, and you take care.
Thank you.
So, thank you to everyone for their incredible 20 years of service, 20 years of commitment to our team, to our community, to working alongside each other. It's now my pleasure to introduce Carlos Schankastel. Carlos is our Executive Director of Quality and Safety, and he's going to talk about and introduce our 25-year Length of Service Awards. Thanks, Carlos.
Thanks, Andrew. I'm very excited to be here as part of this really important anniversary celebration. The people I'm going to read out have been here for 25 years. Wow. Thank you for staying with us all these years. You're now senior members of the Monash Health family and valuable members of our team. Your contribution to Monash Health has been critical to our success. Let me read out the names. Pamela Adcock, Anne-Marie Arfat, Elizabeth Amoroski, Irene Archer, Gillian Armstrong, Soledad Ayusa, Jennifer Bucker, Josephine Barrett, Margaret Beattie, Yolande Galizia, Shelley Black, Jenny Blanche, Wendy Bradshaw, Leonie Britt, Julie Campbell, Ross Carter, Sabina Chittaranjan, Karen Clark, Fiona Connell, Margaret Corbin, Linda Cornell, Michelle Crabtree, Marlon Kramer, Fiona Cran, Martin Crichton, Fiona Cusack, Julia Svetovak, Judy Edwards, Sandra Egbert, Janine Evans, Michael Farmer, Jessie Fong, Ronnie Freilich, Asila Gasta, Linda Gestuisen, Michael Gordon, Susan Gray, Janet Haddo, Karina Hammond, Leslie Hitchcock, Robin Hogman, Carmel Holcroft, Shannon Howard, Rosalie Howe, Andrea Hudson, Amanda Hulley, Yasmin Ivankovic, Andrew Jackson, Carolyn Jackson, Nadia Jantz, Consolacion Favejana, Lisa Jenkins, Robin Jennings, Karen Johnson, Antoinette Johnson, Joanne Jones, Vicky Katsoulis, Karen Kelly, Elda Kimberley, Arthur Kitching, Adnan Cocker, Gok Lau, Lydia Lee, Diane Loyola, Joyce McClure, Evangeline Malkutsis, and Melissa Martin. Thank you all for your hard work, commitment, and efforts over the past 25 years. We really appreciate it. Back to you, Andrew.
Thank you, Carlos, and I can see that Julie's inspired you. Nice hat there.
Thank you. It's a special occasion. I had to dress up for it.
Very good, very good. So our next item is just to give some feedback on our question, Slido question. What do you still want to achieve at Monash Health? And I thought I'd enlist some help and throw to David Valentine. David, how long have you been with us, David?
I joined in August last year, so what are we going to, about 15 months there now?
So I hope your answer to this question would be a heck of a lot.
Given we're here tonight with celebrating 20 and 25 years, obviously I can't speak too well about, my length of service compared to the amazing achievement everyone else has done, but there's a lot to be done at Monash Health, and it's great to have recently joined such an exciting organisation, one with a great vision for the future as well.
So I thought you were perfect to read out some of these, David, but, they might give you some ideas about your time ahead. Over to you.
Yeah, firstly, I just want to say congratulations to everybody that's here tonight. 20 years service and 25 years service for some of you is an amazing achievement, so congratulations. But also thank you for your ongoing commitment and support to the organisation. Without you, what we do as a business wouldn't be anywhere near as successful, so it's amazing to see such commitment being reflected here tonight. But also then the motivation for continuing to want to achieve further things as well. So it's nice to have a quick look through Slido for those of you online, and I'll quickly have a look at some of the answers and just discussion around those. So the question is, what do you still want to achieve at Monash Health? The first one I've seen there is keep on learning. And certainly from my point of view, it's great to see the thirst for learning across the organisation. That we're not done, we're not satisfied with the jobs we do, we want to keep on learning. So that's a great reflection, I think. But there's also a really strong theme around our vision, our mission statement, around excellence. So good to see the continued excellence in patient care, and just a broader theme of excellence has come through in some of those questions and answers. Also, not quite sure, we had this question quite evolved in for one of the responses that makes specific reference to Victoria's Chief Health Officer, Dr. Brett Sutton. He spoke today at the staff forum, which I understand we had over 1,000 people on today, which was a great reflection of the work that he's done, but also what we've all collectively achieved as well in partnership with the department. So the comment there about giving nurses supervision, especially psych nurses, so really that's still what we want to achieve further on. I just seen one popped in there. Someone wants to make it to retirement. With 20 and 25 years service, hopefully we've got a few more years yet, but some of you would be nearing that as well. Another really nice point around the nurturing of others, though, to continue to support and nurture new staff and students so that they get a taste of the great Monash Health culture. And I think that's a really nice point to emphasise, that people make the culture of a business, and a lot of the people that are on service here for tonight for 20, 25 years, you're the lifeblood of the organisation. So that's a really great theme that's flowing through there. Another point here around introducing aromatherapy to mental health. Certainly an interesting point there that I haven't heard of that one before, so it's a nice one for the organisation to take forward. Create, maintain or continue to maintain a positive team culture where everyone feels supported. That's a great sign of a good organisation. Someone's saying they want another 20 years of service, which would get us to 40 or 45 years service. I'm not sure what the record is, but certainly if you get up there, and then they can afford to retire, and they love it at Dandenong. Further development of staff and students to enable ongoing consistent care. And also then the last one down the bottom was finishing training of the next generation. And that's certainly, I guess, what's important for people that have been here for the length of time a lot of people have tonight. Training that next generation of staff is crucial as part of the handing over the baton and really ensuring the growth of the organisation and continuous improvement as well, so as we strive for our excellence. So thank you for all the questions on Slido, and I'll now throw back to Andrew at Mission Control.
Yeah, thanks, David. I'm a bit concerned that our chief nurse might have a bit of an issue about Dr. Brett Sutton providing nursing supervision, but especially the psych nurses, but we might let that one go for you, Katrina, to sort out. I better just pause there, I think, and move on to the next item. So the next thing we're going to do is have a chat to Belinda Power. Belinda, are you there? Can't hear you yet, Belinda.
I think.
There we go. And are we going to get to see you tonight, Belinda?
You can indeed. Hello.
There you are. How are you tonight?
Fantastic.
I was thinking I might just ask Carlos back as well. Carlos, are you still with us?
I am.
Very good. So I understand Belinda works with you.
She does.
Right. So what's Belinda's role, Carlos?
Oh, Belinda looked after accreditation last time round and helped us through all of the accreditation. And she's now looking after the quality partners, the staff that do the quality work in the programs.
How did he do, Belinda?
That's a pretty good summary.
That's good. That's good. Alice, do you know when? Do you have any idea what Belinda started? What her first job was?
No, I don't.
She joined the team at Clayton in 1992. Started clinical rotations as a Bachelor of Nursing from Deakin Uni. Is that right? How am I doing, Belinda?
All right, you're on the right track, Andrew. I was a young student nurse, and most of my rotations were at Monash.
Great. And what's the admin assistant part? Tell me about that.
Yeah, so I kind of digressed in my nursing career a little bit. With a time where there weren't a lot of grad positions, and I just found myself doing other things and just drifted into a bit of an admin stream and worked for the anaesthetic department for quite a while, which, opened up opportunities. I found myself, in the sterilising services unit, wrapping bowls at one point. I think I worked as a ward clerk in ICU. I was an outpatients clerk at one point, checking people into outpatients, did all kinds of things for a while, and, then moved into sort of working for Bill Shearer and the critical care program. So was here when we opened our first simulation centre, which was the first for Victoria, which was very exciting at the time. Had the opportunity to work with the team down there, rendezvousing as all sorts of people in all sorts of scenarios, which was fantastic. Took rural trauma courses out to country towns to share the love out there. Did all kinds of things, and then found myself working for what was the Right Stay project, or one of the first improvement teams that we had back in about 2007. I think we piloted what was the first kind of improvement course that we trialled at Monash. So opportunities, and I think that's the benefit of working in a big organisation. They just tend to come up you, and fortune favours the brave, and sometimes you've just got to take what comes at you.
So if I've got this right, you started as a nurse, you then moved into running anaesthetics, you then moved into engineering, you then looked after rural Victoria, and now you're sort of, I can see that you were set up the medical workforce unit and the inaugural senior medical staff coordinator, and sorted out the junior doctors, and now working alongside Carlos and the rest of the organisation in accreditation. That's a fairly rich journey, Belinda.
Yeah.
And I'm sure you've got lots of interesting memories. I think I hear that a lot about Monash Health, what you just said about the opportunities such a large and diverse organisation offers. And, I've met quite a few people that have started off in one craft, one area of work, maternity or emergency, moved into cardiac, done other things. So it sounds like you've enjoyed the opportunities and diversity that Monash Health's been able to provide.
Absolutely. I think, so looking back over 25 years, as other people have said, doesn't seem like 25 years at all.
I'm sure that there's some interesting memories. Have you got any that you want to share with us?
I think getting us over so I've led in the quality unit the past two accreditations, and the first against national standards, which was a bit of was an interesting journey, but something that I've was one of the most valuable experiences I've had. There's nothing really that stands out. There's little anecdotes and stories. I think, I've grown up at Monash. It's looked after me. I've looked after them, and I think one of the most important things that I've heard is, how do you know that you're doing what you want? And inequality and safety role that I'm in, one of the most compliments to the organisation is, would you recommend it to your family? So my dad, who's currently an inpatient in West 4. So if there's anyone from Dandenong, look after Dad, please. He's a grumpy old man, but he really is good at heart. You know, I'm glad that he's here, and I wouldn't wish him to be anywhere else. So I guess that's how I feel about Monash.
That's a great testament to, I think, to exactly how you feel about Monash. I can see that Kate McDermott's tuned in tonight to celebrate your award as well, which is great to see. Thank you for sharing all of that, Belinda, and thank you for everything you do. That accreditation journey last time had its interesting moments. I thought you were very tactful in the way you talked about that, and we're looking forward to next year. Hopefully, with our preparation that we've been doing, we'll be well positioned.
Absolutely.
Okay, thank you, Belinda, and again, thank you for all the work you've done for Monash Health. On that note, I'd like to introduce our last speaker, our last group of awards, and that's our colleague Louise Canis, who's our Executive Director of Public Affairs and Communications. Hi, Louise.
Hi, Andrew.
How are you going? Louise always gets a bit nervous with these events because, of course, we do just take a moment and thank Louise and the team, Alison, Tim, Jeremy, and all the great work that they do, and many others in pulling this event together. It's not straightforward. It's very different and got lots of aspects of will it go right and will it work. Amelia and the IT team and many others involved. So thanks, Louise, and thank you to the team for going well, and over to you.
It's absolutely our pleasure. Yeah, I do hope that all of those who are online tonight feel recognised and celebrated, because if I can, echo what Deepak and Andrew and the other executives have commented this evening, we want you to know that you are indeed valued and appreciated, and it's why I get, so anxious about these events. I want them to be special for you. I know sometimes, in the day-to-day of our work, a celebration of you may feel distant, but tonight really is for you. I look forward to being able to see you and say thank you. Again, I know my colleagues feel the same, but please do come and say hello when we next get a chance to see each other. So thank you. And the last, but certainly not least, group of names, it's my pleasure to read out Robert Meek, Joanne Mikolitsis, Nerida Mitchell, Melissa Moody, Camille Mortensen, Leanne Murray, Huong Nguyen, Rosemary O'Connell, Elaine O'Kelly, John O'Leary, Laurel O'Loughlin, Helene O'Malley, Debbie O'Wise, Jennifer Pace, Cherie Partington, Belinda Power, Annarine Pragnaskira, Grace Presti, Tina Rathbone, Mary Lou Rees, Caroline Rhodes, Uta Ryan, Bernadette Sadler, Pei C, Frederick Seneviratney, Jennifer Senior, Rianne Centric-Rafe, Zafia Satelli, Jeffrey Smith, Nicola Spry, Julie Stathis, Suzanne Summers, Mark Tarrant, Fiona Temby, Suat Tur, Eric Thompson, Suzanne Thompson, Melissa Thompson, Stephen Tupakis, Heather Turner, Irina Vasserman, Catherine Veal, Amanda Vincent, Joanne Maunder, Amanda Walker, Wendy Watkinson, John Waugh, Andrea Williams, Marie Wisniewski, Priscilla Zhang, Magda Ziad, and Norman Zimmerman. Congratulations and thank you very much. Andrew.
Thanks, Lou. So that concludes our evening with almost 400 people that we've been able to celebrate their time with Monash Health. We have one more night to go tomorrow night, where we celebrate those that have served 30 plus years. But for tonight, thank you to everyone that's joined us for the 25-year anniversaries. And we thought we'd take an opportunity to share a few more stories of some of our longer serving employees and their experience at Monash Health. I'd like to leave you with that video. Congratulations again for your many years of service. Thank you for joining us tonight. I hope you have a fun night ahead, and take care and be safe. All the best.
One word that would describe my colleagues is supportive. We support each other through good and bad times.
Thinking about it, I guess I would say they're keen. Because they're keen to be there, they're keen to work, they're keen to learn.
What's a word to describe my colleagues? Knowledgeable.
There's one word that I can describe my colleagues at Dandenong, and that is that they're a terrific lot of people to work with.
Generous. They wouldn't be doing it if they weren't giving people.
They're a wonderful bunch of girls and boys.
Over the last 40 years, I've seen a lot of changes, but the fundamental reason that I do nursing is looking after patients and their families. I've survived EMR, that was a crazy time, and I've survived COVID. So I think you just go with the flow and just keep learning. And
The thing I'm most grateful for in my time at Monash was the opportunities that I've been given right from the first year of my work.
I've seen a lot of changes, but I'm open to the changes because changes can bring good outcomes.
Change is good for all of us. It can scare you a bit. Probably scared me a lot over the years, but I've been happy to embrace it, and then when you come out post-change you realise how good it was and that you're very glad that you took the chance with it.
I love the job that I do, so the rest just falls into place very easily. Great staff, thoroughly enjoy looking after patients and their families, and I hope to continue a few more years.
It's important not to make assumptions about or judgments about people because they come from all different areas of life and backgrounds and experiences. The place keeps me grounded. So when I leave here on a Saturday afternoon, driving back to Phillip Island where I live, if I feel on the way up that I had things on my mind that were that I might have been feeling anxious about or sad about, by the time I finish here and drive home, I think, how lucky am I?
2020's been interesting. It's been very difficult and it's been a real battle for a lot of people, but I think what we've learnt, and certainly what we've learnt in the pharmacy, is that we can deliver our services differently but still do it effectively.
The pandemic has taught me to be very flexible because at my age, that's quite hard to do. I had to move out of intensive care where I have worked for 40 years because it is a high-risk area, and I had to move to a surgical ward. So I have to learn new processes.
So obviously every day is a learning curve, none of us know what's coming next. But it's taught me, in fact reinforced for me, that the human race, that we are very adaptable. We have a situation which can be so devastating, and yet we can find ways of doing things a little bit different and still achieve what needs to be achieved.
2020 has taught me to probably take a step back, to think, to support everybody. It's been a very tough year for us in ICU, and I think in the whole hospital. And I think the most powerful thing is that we are all in this together.